Hi, my name is Shaquana, and I did my project on chlamydia. So, chlamydia trachomatis is obligated intracellular parasite that needs host cells to survive. It's gram negative, which means it does not retain the crystal violet stain that is used during the gram staining. It is a rod shape. It's anaerobic, which means it does not require oxygen for growth. And it's non-model, that means not able to move on their own. And there are two forms, and that is the elementary bodies, which is an infectious particles that is spread between the hosts. And then you have the reticulate bodies, that is non-infectious intracellular form that copies the host. It's the most common STD or STI in Europe and the US since the late 1900s. It's present in humans for many centuries. The name comes from a pattern that was established in the late 19th century, named after its pathogen. It became a public health issue in the late 1970s and early 1980s. It was recognized in Rome and Greece, known as trachoma. It was first considered a virus due to the small size, but further testing was done. And with this, it caused a delay in treatment. So it was originally discovered in 1907 by biologist Stanislaus von Herwacki and German radiologist Ludwig Halberstaedter. Sorry if I pronounced those wrong. They named it Chlamydia dosa, which they thought it was a mantle protozoan. Um, so in 1966, it was discovered to be a bacterium by using a microscope. And so I did insert a picture here of the two people that discovered it back in 1907. And those two people are the one that's standing up with glasses, and then the other one that's sitting down with like the instrument on the orangutan. But it's showing that the two gentlemen during their research of high cytoplastic inclusion bodies of tracheoma. So chlamydia trachomatis causes chlamydia. You sometimes may not have any symptoms, which can cause serious health problems if left untreated. Um, so like some of the signs and symptoms in men and women are a little different. Some of them are the same. So in men, they may have some burning urine sensation when urinating, some discharge from their penis, and pain and swelling in the testicles, and it can be in just one testicle or both testicles. In women, they have the abnormal vaginal discharge, the burning sensation when urinating, and also some pain or discomfort in their abdomen. Here I have on this slide the mode of transmission. The infection can be passed through unprotected sex, and that's through vaginal, anal, or oral. Infected semen or vaginal fluid in the eye, and that's if someone has had intercourse and happens to lay on the bed or wherever intercourse was at, and they get the semen or fluid in their eyes. And also, if a mother is pregnant, she can pass it to the baby if she's not treated. So it's really good to get all that type of testing done during your pregnancy. So with the pathophysiology, it invades the host of cells and it starts to infect them. Once the are infected by the bacteria, it starts to starve the nutrients and the bacteria begins to die off. So when the bacteria is being starved of vitamins, iron, or other nutrients, they no longer divide and starts to grow very, very large. Although the cells can remain working, and it also can return to a normal state when the host cells return to the normal state as well. With Chlamydia trachomatis, replication also happens. The host cell with the elementary bodies, as I stated in the previous slide, is the infectious particles, turns into the reticulate bodies, which is the non-infectious intracellular form of the bacteria. And then in this process, end up making new elementary bodies, which are the infectious particles. And the host cells are then damaged. It releases inflammatory markers or meteors. And this can lead to tissue damage such as scarring, chronic inflammation, or destruction. So, how do chlamydia make you sick? It can make you sick in several different ways. They have the pelvic inflammatory disease, which is an infection that can be spread to the uterus and the fallopian tube, causing damage to the reproductive tract. Epididymis, which is inflammation of the tube that stores and carries the sperm. Prostatitis, which is inflammation of the prostate gland, causing painful urination, pain during and after sexual intercourse, etc. Reactive arthritis that affects the joints, the eyes, and the urethra. You also have neonatal infection. This is when mothers have it and don't get treated. It can cause like low birth weight, preterm deliveries. As I mentioned earlier, also the pink eye, that's from the fluid in the semen that comes in contact with your eye. And also, let me mention with the pelvic inflammatory disease, it can cause or lead up to infertility as well in women. So here on this slide, it tells you about different tests that they use to test for chlamydia. One of the most accurate tests they use, but also the most sensitive test, is the nuclei acid amplification test. And this is where they find the genetic DNA material of the bacteria. Then you have the enzyme link immunosorbent assay test, and this is where it finds a substance that triggers the immune system. You also have the direct fluorescent antibody test, and this finds the chlamydia antigens. And then you also have the chlamydia culture test, and this suspects the growth of chlamydia in the vial of the cells. But this test does take a couple of days for the results to come back, and it seems to be more expensive than any other test that they use or any of the ones on this slide. So mostly people go with the most accurate test. So on this side, we have the smears, which is the Gimson, and it's used to examine the specimen. It does give important information within an hour. However, with this test, you do not want to use a swab. You just use a spatula. And during this process, the specimen is air dry, methanol is used, and then it's placed in the stain. You must use a microscope to see it. And it's not offered as much due to the lack of personnel experience. So I did put this picture over to the side, and it shows you how it looks with the stain and also with iodine stain. So as far as treatment for chlamydia trachomatis, it is treatable and curable. Majority of the time, doctors do a single dose of antibiotics or give someone tablets to be taken over a certain period of time. And it's usually between 7 and 14 days. Those tablets are usually the azithromycin and the doxycycline, and I posted these on the slide as well. Um, Everybody's dosage will probably be different, so it's not always the same 250 milligram and the other 100 milligram dosage. Um, you must complete the medication. Do not stop even if symptoms are gone. You want to continue the medicine that the provider give you. If he give you 7 days, 14 days, 10 days, whatever the amount of time is, you want to make sure you continue those medication for those amount of days so you can be treated and it can cure. If not treated for a long period of time, antibiotics cannot repair any of the permanent damage that I mentioned earlier in the slide in the presentation to your body. So you want to make sure you get tested, treated whenever you think you may be exposed to this infection, this bacteria. So yeah, just please make sure to continue the medication regardless if you're feeling better. A couple of interesting facts that I found about the chlamydia. Most importantly, they call it the silent infection because, as I mentioned, you sometimes do not have symptoms. Like people walk around here days, months, years with it and never have any type of symptoms, so they don't go get treated. And so, excuse me, that's one of the things why they call it silent infection. Because people don't have symptoms and they just don't know they have it. 128.5 million new cases of chlamydia was determined in 2020 with the ages of 15 to 49 years old. Um, as I mentioned earlier, it can be treated easily with, one dose of antibiotics or the pills, capsules for 7 to 14 days or however many days the provider suggests. And still to this day, it's still considered the most common STD, STI worldwide. So here are my references that I use to do my presentation. So once again, just make sure you get tested. If you need to be tested, do not prolong the treatment for chlamydia. Like I stated several times in this presentation, it is known as a silent infection. You may not know that you have it. So just be careful out there. So once again, these are my references that I use, and thank you for watching.